everyone, Dr. Ryan here. I'm a board certified specialist physician. Thank you so much for joining me in the OSCE series of videos. Remember, OSCE stands for Objective Structured Clinical Exam, where we are presented with some exam finding or some investigation and we're asked to interpret, and the stems of the questions are based on those. This series is designed to give us a conceptual approach to answering these, as well as disseminating some important medical information. God bless you. Thanks for joining me. Today we're talking about pseudogout. If you haven't yet subscribed to my channel, I strongly encourage you to smash that subscribe button. Alrighty, what do we have here? Let's just get my pen in there first up. This is polarized light microscopy of synovial fluid in a patient who presented to you with acute monoarthritis. What do we see here? We'll talk about that. This is an X-ray showing classical opacities, as you can see, of the joint margins. So the stem of the question says, describe your findings for 2 marks. What's the diagnosis for 2 marks? Name 4 associated conditions and what would you expect to see on a joint X-ray for 1 mark, and then provide a plausible differential for this finding for 5 marks. So describe the findings, okay? We're going to look at the answer, then we go back to the actual image. So this is polarized light microscopy. And what you can visualize is rhomboid crystals, which are only weakly positive on birefringent light, right? And are more difficult to detect. So the weakly positive, so birefringence means that the light is hitting in 2 directions, parallel and perpendicular, right? And so these you can see is rhomboid shaped crystals, right? Versus gout. In gout you get negatively birefringent needle shaped crystals. Here we get slightly positively birefringent rhomboid shaped crystals, right? And this X-ray shows us chondrocalcinosis. These are little opacities that you see at the joint margins, right? And yeah. So what's the diagnosis here? Undoubtedly, rhomboid crystals, only weakly positive birefringent light, more difficult to detect. This is pseudogout or calcium pyrophosphate dehydrate deposition disease, CPPD. Name 4 associations with pseudogout or CPPD, which is calcium pyrophosphate dehydrate or dihydrate deposition disease. Well, there's a whole host of these. Sorry, this doesn't really project very well, but kind of a lot of associations with aging. And with aging, you know, you can have associations with CPPD and being disease-associated factors, primary hyperparathyroidism, hemochromatosis, which we spoke about in episode 4 of our OSCE series, hypophosphatasia, hypomagnesemia, chronic gout is associated with pseudogout, and post-meniscectomy. Epiphyseal dysplasia, a whole lot of hereditary issues as well. Yeah. And just drawing some comparisons between gout and pseudogout. If you look at gout in terms of risk factors, so males, risk factor, obesity, diabetes, hypertension. So it keeps company with our metabolic risk factors, right? Dyslipidemia, alcohol use. Versus pseudogout, which is associated with trauma and a lot of hypos, hypothyroidism, hypoparathyroidism, hypomagnesemia, hemochromatosis. Look at episode 4 of the OSCE series for more on that, right? And gout puts you at risk for uric acid kidney stones, whereas there's no real associated risk for that in the setting of pseudogout. Triggers for gout is a large meal, alcohol use, trauma, surgery, dehydration. There's no such triggers for pseudogout. Treatment of gout is, we split them or stratify them into the acute phase and prophylaxis. Right? Acutely, you want to use your non-steroidals for that acute inflammation. Colchicine as well has been used in times past, and glucocorticoids. And prophylaxis in the way of allopurinol, which is a xanthine oxidase inhibitor, febuxostat, avoid your triggers. We also got pegloticase in refractory disease. In pseudogout, we use non-steroidals and glucocorticoids, just like how we use in the acute phase of gout, and prophylaxis as well with colchicine. Okay, and the joints which are affected in gout, usually gout has a predilection for certain joints, right? Usually the small joints, and the classic presentation is podagra, which is the first metatarsal joint of the foot, the big toe, right? Whereas pseudogout likes the large joints. It goes big or goes home. Large joints, especially the knee, which is most common, also affects the elbows, the shoulders, and the wrists. And of course, we already touched on this, that in synovial fluid analysis, what you will see is monosodium urate crystals, which are needle-like and sharp and negatively birefringent, versus in CPPD, which is pseudogout, where you get rhomboid-shaped, positively birefringent crystals on polarized light microscopy. Okay, what would you expect to see in a joint X-ray? And what we said was chondrocalcinosis, and differential for this for 5 marks. The acronym here is whoop-a-dog, whoop-a-dog, woof, woof. right? Whoop a dog. So W is Wilson's disease, all right? H speaks to hemophilia, hemochromatosis, and all your three hypos: hypomagnesemia, hypothyroidism, hypophosphatasia. I is for idiopathic, which happens with aging, and this by far is the commonest cause of pseudogout, or calcium pyrophosphate dihydrate deposition disease. P is for pseudogout, it's a misnomer there. P is silent. A is amyloidosis, D is diabetes mellitus, O is ochronosis, G is gout. All of this will cause chondrocalcinosis on the joint X-ray. Okay, my friends, the book of Isaiah chapter 55 verse 6 says, let's get my point in. Seek the Lord while he may be found. Call on him while he is near. Now, the word while tells us, this implies that there will be a time when God will not be found. Indeed, we are living in the last days. It's now time for us to draw close to God. Jesus told us a parable about the wise and foolish virgins. So, what the wise virgins had was wisdom. They had wisdom which represents oil, which preserved them until the bridegroom came. And so let us not lose our fervor, let us not lose our passion for acquiring wisdom, spending time with the Word and praying, that we will be ready for the second coming of the Lord. Have yourself a lovely day. I'll see you soon with another handy video in this series. God bless.